Hello, this is Dr. Gay from First Look MRI, and this is a 25-year-old male who injured his knee recently. He's got lots of swelling around the knee, and he has some interesting findings here. So on this sagittal view, we have the femur and the tibia here. Same view over here. We see the PCL, posterior cruciate ligament, looks normal. Looks like a candy cane here. And the ACL should go the other direction like this, but the ACL is non-visualized. This is part of the ACL here laying down horizontally in the joint, so it looks like the ACL is completely torn. And this is a bit unusual because almost invariably when the ACL is torn, we'll see a bone bruise back here and another bone bruise here. The tibia will shift forward. It's like a pivot shift type injury, and this will impact over here in the terminal sulcus of the lateral condyle, but there's no bone bruise and the tibia is not shifted forward. So a different mechanism of injury, it looks like, than typical. But the ACL does look like it is completely torn. Also, there's an unusual little band of fluid back here in the back of the knee we're going to look at. This is an axial view. Now, when people tear their ACLs, they usually have, or they can commonly have other findings. So one of the other findings is back over here. This is the fibula in the back lateral side. There's a muscle here called the soleus. And the soleus muscle comes down. Here's the soleus. Superficial is the gastrocnemius. And that soleus muscle looks good here. But as we go up, 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 we see it become bright. So this is a strain or partial tear of the soleus. Right here is really bright. So partially torn, stripped from the fibular attachment proximally, right in this region here. And that's a common finding with ACL tear. Now there's another finding we have over here on this coronal view. This is called coronal view, looking straight at the patient. We see the femur up top. We see the tibia down below. We see a meniscus over here, a little black wedge called the lateral meniscus, looks good. We see the medial meniscus over here looking good, so the menisci are good. We see the posterior cruciate ligament, good. The ACL should be here, it is torn. Now we're going to look at the medial collateral ligament, MCL. Looks good on this slice, but when we go one slice forward right here, we see that it is wavy, attenuated. So this is a partial tear or sprain of the proximal fibers, just the anterior margin of that. So a low-grade sprain of the proximal fibers of the medial collateral ligament over here. Not a big deal. If we look on the lateral side, though, we see something a little bit more prominent. This is called the fibular collateral ligament that comes off the femur. It comes down here and it's going to join with another tendon to form the conjoined tendon. This is the biceps muscle, and it's going to come down, turn into the tendon, and this tendon is also going to join here with the fibular collateral ligament to form the conjoined tendon. And it's hard to see these coming together, but this one here, the fibular collateral ligament, is gray, ill-defined. So this is a partial tear of the fibular collateral ligament. Here it's coming over to here. The biceps muscle looks good. The biceps tendon looks good. So it's just a tear of the fibular collateral ligament or sprain of the fibular collateral ligament, and the conjoined tendon is right here. So the conjoined tendon will come down here and attach to the fibula. There's a fibular head here, and we can see the tendon coming down, and we see a little line of bright. This is fluid where this tendon should be. So this should attach right here, but instead it's torn back, and there's a little fluid-filled gap. Here it is again. So this is a tear, a high-grade partial tear of that conjoined tendon from the fibular head. And when we have injuries over here, we call this a posterior lateral corner injury. And there's also something that comes back here, another ligament, the popliteal-fibular ligament that I don't really see very well. It's hard to see even in the best cases, but I believe that is torn as well. So posterior lateral corner injury, common to find, or not common, but something that we look for in patients with ACL tears. And this patient has, again, a significant posterior lateral corner injury with a torn fibular collateral ligament, and it retracted just a little teeny bit. Now there's a couple other significant findings that make this case even more interesting. So if we go up here, we see a muscle here. This is the lateral gastrocnemius. It comes off the lateral femur, and right here is part of the muscle. And this is the medial side, medial gastrocnemius. And the medial gastrocnemius, lateral gastrocnemius, the medial gastrocnemius, the deep fibers look like they're partially torn. There's a little bit of edema here in the muscle. Should look dark and gray. Here it's bright. So a partial tear or strain of the medial gastrocnemius muscle belly. And also the lateral gastroc has edema within it. It's partially torn. And there's a little fluid collection right over here. and you can see that fluid collection right here. So this is the gastrocnemius, and then there's this fluid-filled space here. And there's another thing called the plantaris muscle, a small muscle that comes off here. It usually blends with this muscle. It's hard to tell them apart, but maybe this is part of it. And we see fluid where it should be. So it looks like this lateral gastrocnemius, partially torn, and the plantaris, which is a small muscle, very hard to see, maybe right here, is torn as well. And there's a tendon from the plantaris. Maybe this is part of the plantaris here. The tendon will come down here, it'll shoot across, and usually go down in here. And instead of seeing a tendon down here, a really tiny tendon, we just see fluid. So this is hemorrhage or edema, and this is a common finding with a plantaris muscle rupture. So the plantaris, when it tears, it will have the fluid leak down in here, and we see a little band of fluid just like this. So this is a little sign of a plantaris muscle rupture. Not 100%, but again, with this finding up here, both these muscles torn, and poor visualization of the plantaris, and this edema or hemorrhage here, I'm pretty confident this is a ruptured plantaris. And that's another finding with ACL tears. And that's it. Thank you very much.